Question 1. In the three-term contingency, what does the A stand for? A. Ability. B. Assessment. C. Antecedent. D. Action. Answer: C. Antecedent. This question is asking about the very basic building block of understanding behavior in ABA, the three-term contingency. This simple model helps us analyze why a behavior happens. It consists of three parts: the antecedent, the behavior, and the consequence. A BC. The A stands for antecedent, which is what happens right before the behavior occurs. It's the environmental event, stimulus, or cue that sets the occasion for the behavior. Understanding the antecedent helps us predict when a behavior is likely to happen. For instance, if you hear your phone ring, antecedent, you might answer it, behavior. The antecedent comes before the behavior in the chain. Question 2. When a child earns points for completing homework assignments, and these points can be exchanged later for access to screen time, the points are functioning as A. Primary reinforcers. B. Conditioned punishers. C. Unconditioned reinforcers. D. Conditioned reinforcers. Answer: D. Conditioned reinforcers. This question is about different types of reinforcers, specifically conditioned reinforcers. Points, money, tokens, and praise are common examples. A conditioned reinforcer is something that wasn't originally reinforcing, but becomes one because it's been repeatedly paired with other things that are reinforcing, like primary reinforcers, such as food or water, or already established conditioned reinforcers like screen time or toys. The points themselves don't have innate value, but they gain value because they lead to something the child does want: screen time. Primary or unconditioned reinforcers are naturally reinforcing without learning. Remember, conditioned reinforcers are learned reinforcers because they lead to something else good. Question 3. Which of the following is an example of a behavior that is observable and measurable? A. Feeling sad. B. Understanding instructions. C. Writing their name. D. Being frustrated. Answer: C. Writing their name. This question is about defining behaviors in a way we can actually work with in ABA. For a behavior to be useful for measurement and intervention, it needs to be observable. You can see or hear it, and measurable. You can count it, time it, etc. Feeling sad, understanding instructions, and being frustrated are internal states or interpretations that we cannot directly observe. However, writing their name is a specific action that you can see happening, observable, and count how many times it occurs or measure how long it takes. Measurable. Always define behaviors by what you can see or hear someone doing. Question 4. What is the goal of a functional analysis? A. To interview parents about problem behaviors. B. To directly test hypotheses about the function of a behavior. C. To observe behavior in the natural environment. D. To count how often a behavior occurs. Answer: B. To directly test hypotheses about the function of a behavior. This question asks about a functional analysis, which is a specific type of functional behavior assessment. FBA. While other FBAs might involve interviews or naturalistic observation, a functional analysis is unique because it involves manipulating, changing the environment in a controlled way to see how it affects the behavior. By systematically presenting different conditions, like attention being available, tasks being available, items being available, or being alone, analysts can directly test why the behavior is happening, what function it serves: attention, escape, tangible, automatic. It's like running mini experiments to figure out the cause and effect relationship. Question 5. A child is given a cookie immediately after they say cookie. In the future, the child is more likely to say cookie when they see a cookie. Saying cookie is the behavior. Seeing the cookie is the A. Consequence. B. Reinforcer. C. Antecedent. SD. D. Motivating operation. MO. Answer: C. Antecedent. SD. This scenario walks you through the three-term contingency again, focusing on identifying the antecedent. The behavior is saying cookie. What happened right before the child said cookie? They saw the cookie. This seeing the cookie is the environmental event that prompted the verbal response, because saying cookie in the presence of a cookie was reinforced. The cookie acts as a discriminative stimulus, SD, signaling that saying the word will get a good outcome. The consequence, getting the cookie, happened after the behavior. The cookie is the reinforcer, but the stimulus that triggers the behavior is the antecedent. Question 6. When teaching a new skill, a therapist provides extra help, prompts, to ensure the learner responds correctly. As the learner becomes more independent, the therapist gradually reduces the amount of help. This process of reducing prompts is called A. Shaping, B. Chaining, C. Fading, D. Discrimination training. Answer: C. Fading. This question describes fading. Fading is the process of systematically decreasing the level of assistance, prompts, you give a learner as they learn a new skill. You start with prompts strong enough to guarantee success, and then slowly reduce them so the learner eventually performs the behavior correctly with only the natural cue, the SD. For example, if you use hand over hand to teach writing, you fade to just touching the hand, then the wrist, then the elbow, then just gesturing, until no prompt is needed. Shaping teaches a new behavior through approximations, chaining breaks a skill into steps, and discrimination training teaches different responses to different stimuli. Fading is about slowly removing the help. Question 7. Which schedule of reinforcement results in the highest, most consistent rate of responding? A. Fixed ratio, FR. B. Variable ratio, VR. C. Fixed interval, FI. D. Variable interval, VI. Answer: B. Variable ratio, VR. This question asks about the effects of different reinforcement schedules on behavior rate. Variable ratio, VR. Schedules deliver reinforcement after a varying number of responses, and they are famous for producing high, steady rates of behavior with very little pausing after reinforcement. Think of slot machines again, a classic VR example. People keep pulling the lever at a high rate because they never know which pull will pay off, and the next one could be the winning one. Fixed ratio causes pauses after reinforcement, and interval schedules, FI and VI, generally produce lower rates than ratio schedules. VR means high, steady responding. Question 8. A behavior analyst is measuring the time it takes for a child to begin following an instruction after it is given. What dimension of behavior are they measuring? A. Duration. B. Frequency. C. Latency. D. Interresponse time, IRT. Answer: C. Latency. This question asks about the dimension of behavior called latency. Latency is the measure of the time between a stimulus, like an instruction or a cue, and the start of the behavior. The key phrase here is time it takes for a child to begin following an instruction after it is given. If the instruction is sit down, latency is the time from when you say sit down until the child starts the movement to sit. Duration is how long they stay sitting. Frequency is how many times they sit down. IRT is time between two instances of sitting. Latency is that waiting time before the action begins. Question 9. Which of the following is an example of negative reinforcement? A. Giving a child a sticker for cleaning their room, leading to more cleaning in the future. B. Taking away a child's tablet for misbehaving, leading to less misbehaving in the future. C. A person taking an aspirin to get rid of a headache, leading to taking aspirin more often for headaches in the future. D. A teacher sends a student to the principal's office for disrupting class, leading to less disruption in the future. Answer: C. A person taking an aspirin to get rid of a headache, leading to taking aspirin more often for headaches in the future. This question tests your understanding of negative reinforcement. Negative reinforcement involves removing or taking away something unpleasant after a behavior occurs, which makes that behavior more likely in the future because it successfully removes the unpleasant thing. In option C, the behavior is taking aspirin and the unpleasant thing being removed is the headache. Because taking aspirin successfully removes the headache, the person is more likely to take aspirin when they have a headache again. Option A is positive reinforcement, adding a sticker. Options B and D are forms of punishment, taking something away or adding something unpleasant to decrease behavior. Question 10. A child is taught to fold laundry by reinforcing the completion of the last step, putting the shirt in the drawer, then the second to last step, folding the shirt, and the last step, and so on, working backward. This teaching method is called A. Forward chaining, B. Backward chaining, C. Total task presentation, D. Shaping. Answer: B. Backward chaining. This question describes backward chaining. When using a task analysis to teach a skill with multiple steps, backward chaining means you teach the steps starting from the end of the sequence. You prompt the learner through all steps except the very last one, and you reinforce them for successfully completing the last step independently. Once the last step is mastered, you teach the second to last step plus the last step, and so on, gradually adding steps from the end of the chain towards the beginning. Forward chaining starts from the first step, and total task attempts all steps at once. Backward chaining reinforces the completion of the sequence, giving a strong sense of accomplishment at the end. Question 11. Which type of functional behavior assessment, FBA, involves manipulating variables in a controlled setting to determine the function of a behavior? A. Indirect assessment, B. Descriptive assessment, C. Functional analysis, D. Preference assessment. Answer: C. Functional analysis. This question specifically asks about the type of FBA that involves manipulating variables in a controlled setting. This points directly to a functional analysis. Indirect assessments, like interviews or questionnaires, gather information from others. Descriptive assessments, like ABC data, involve observing the behavior in the natural setting without manipulation. Preference assessments find out what a person likes. A functional analysis is the most scientifically rigorous type of FBA because it allows direct testing of the relationship between environmental conditions and the behavior by systematically changing those conditions. Question 12. What is the defining characteristic of a reinforcer? A. It is something the person says they like. B. It is delivered immediately after a behavior. C. It makes the behavior that it follows more likely to occur in the future. D. It is always a tangible item. Answer: C. It makes the behavior that it follows more likely to occur in the future. This is one of the most essential concepts in ABA. A reinforcer is defined by its effect on behavior. It doesn't matter what the item or event is or how the person feels about it. If the behavior it follows increases in the future, then that consequence was functioning as a reinforcer for that individual in that situation. While reinforcers are usually delivered immediately and are often things the person likes, these are factors that increase the likelihood of something being a reinforcer, but they are not the definition itself. The definition is all about the future increase in behavior frequency. Question 13. When a behavior occurs less often in the presence of a specific stimulus than it does in the absence of that stimulus, the stimulus is likely a A. SD. Discriminative stimulus. B. SD. S delta. C. Conditioned reinforcer. D. Unconditioned punisher. Answer: B. SD. S delta. This question defines an S delta, SD. An SD is a stimulus that signals that a specific behavior is not likely to be reinforced or might even be punishedy. Because reinforcement is not available, the behavior occurs at a lower rate or doesn't happen at all when the SD is present compared to when the SD is present, where reinforcement is available. For example, asking your busy parent for a toy might be an SD situation. less likely to get reinforced CD, whereas asking when they are relaxed might be an SD situation more likely. In SD signals, reinforcement is available. In SD signals, it's not. Question 14. Which measurement method is best suited for behaviors that have a clear beginning and end and occur at a moderate rate? A. Duration. B. Latency. C. Frequency/rate. D. Whole interval recording. Answer: C. Frequency/rate. This question asks about the best measurement method for behaviors that are discrete, have a clear start and end, and aren't happening constantly. Frequency, a simple count, or rate, count per unit of time, is the most appropriate way to measure how often such behaviors occur. Duration measures how long a behavior lasts. Latency measures the time to start. Whole interval recording measures if a continuous behavior occurs throughout an interval. For distinct, countable actions like hitting, saying a word, or raising a hand, frequency or rate gives you the most accurate picture of how often it happens. Question 15. A child whines every time they are asked to eat peas. The whining causes the parent to remove the peas. The child whines more in the future when given peas. This is likely an example of behavior maintained by A. Positive reinforcement, attention. B. Negative reinforcement, escape. C. Positive punishment, presentation of something aversive. D. Automatic reinforcement. Answer: B. Negative reinforcement, escape. This scenario describes negative reinforcement focused on escape. The behavior is whining, and the consequence is the removal of the peas, something the child wants to avoid. Since the removal of the peas makes the whining more likely in the future when faced with peas, the behavior is being negatively reinforced because it allows the child to escape an unpleasant situation, eating peas. The key is the removal of the aversive stimulus, peas, increasing the future likelihood of the behavior, whining. Question 16. When teaching a new behavior, a therapist physically guides the learner's hand to perform the action. This type of prompt is A. Verbal. B. Gestural. C. Model. D. Physical. Answer: D. Physical. This question is about types of prompts used in teaching. A prompt is any extra cue or help given to increase the likelihood of the learner making the correct response. A physical prompt involves providing physical contact to guide the learner's movement. Since the therapist is physically guiding the learner's hand, this is a physical prompt. Verbal prompts are spoken words. Gestural prompts are movements like pointing, and model prompts involve demonstrating the behavior. Physical prompts can range from full guidance, hand over hand, to partial guidance. Question 17. A teacher reinforces a student for every 5 math problems they complete. This is an example of which schedule of reinforcement? A. Fixed ratio, FR. B. Variable ratio, VR. C. Fixed interval, FI. D. Variable interval, VI. Answer: A. Fixed ratio, FR. This question describes a fixed ratio, FR, schedule of reinforcement. In an FR schedule, reinforcement is delivered after a fixed or set number of responses. The keywords are every 5 math problems and complete. The number 5 is fixed, and the reinforcement, praise, token, etc., is given after that specific number of responses, completed problems. VR has a varying number of responses, and interval schedules, phi VI, are based on time. This is a clear example of reinforcement tied to completing a set number of tasks. Question 18. Which term refers to the physical form or shape of a behavior? A. Function. B. Latency. C. Topography. D. Magnitude. Answer: C. Topography. This question asks about the topography of a behavior. Topography refers to what the behavior looks like, its physical characteristics, its form, or its shape. For example, if someone is hitting, The topography might be an open hand slap versus a closed fist punch. The function is why the behavior occurs, latency is the time to start, and magnitude is the intensity. Topography is simply the observable form of the behavior itself. Question 19. A child is afraid of dogs. You pair the sight of a dog, a previously neutral stimulus that became scary, with receiving highly preferred treats, a primary reinforcer. Over time, the child's fear response to the dog decreases, and they associate the dog with good feelings. This process is most aligned with principles of A. Operant conditioning, B. Respondent conditioning, C. Punishment, D. Extinction. Answer B. Respondent conditioning. This scenario is an example of using principles from respondent conditioning, also known as Pavlovian or classical conditioning. Respondent conditioning involves pairing a previously neutral stimulus, or a conditioned stimulus like the dog, which elicits fear, with an unconditioned stimulus, like receiving treats, which elicits a positive emotional response. By repeatedly pairing the dog with the positive experience of getting treats, the emotional response to the dog changes. Operant conditioning deals with learned associations between behaviors and consequences. This example is about changing an involuntary emotional response through stimulus pairing, which is respondent conditioning. Question 20. The process of teaching a complex skill by breaking it down into smaller steps and teaching the steps in sequence is called A. Shaping, B. Discrimination training, C. Generalization, D. Chaining. Answer D. Chaining. This question defines chaining. A behavior chain is a sequence of individual responses that, when performed in a specific order, lead to reinforcement. Chaining is the teaching procedure used to teach these complex sequences. It involves breaking the skill into manageable steps using a task analysis and then teaching the learner to perform the steps in order. Shaping teaches a single response through approximations. Discrimination training teaches when /word respond. Generalization is the spread of a learned behavior. Chaining is specifically about linking together a series of steps. Question 21. Which procedure involves providing reinforcement for the absence of a specific behavior during a specific period of time? A. Differential reinforcement of incompatible behavior, DRI. B. Differential reinforcement of alternative behavior, DRA. C. Differential reinforcement of other behavior, DRO. D. Differential reinforcement of low rates, DRL. Answer C. Differential reinforcement of other behavior, DRO. This question describes differential reinforcement of other behavior, DRO. DRO involves reinforcing the learner for not doing the target problem behavior for a defined interval of time. You reinforce anything else, or simply the passage of time without the behavior, as long as the specific problem behavior does not occur during that interval. DRI reinforces an incompatible behavior, DRA reinforces an alternative behavior, and DRL reinforces the behavior at a lower rate. DRO is reinforcing the omission or absence of the problem behavior. Question 22. When you want to increase a behavior, you use reinforcement. If you want to decrease a behavior, you might use punishment or A. Generalization, B. Prompting, C. Extinction, D. Chaining. Answer C. Extinction. This question presents two main strategies for decreasing behavior in ABA: punishment and extinction. Extinction involves stopping the reinforcement that was previously maintaining the behavior. When the behavior no longer produces the expected consequence, it should decrease over time. Generalization and prompting are used to increase or teach behaviors. Chaining is a teaching procedure, while punishment adds or removes a stimulus to decrease behavior. Extinction decreases behavior by removing the reinforcer that kept it going. Question 23. What is the main advantage of using direct observation methods, like ABC Detail, in a functional behavior assessment, FBA, compared to indirect methods, like interviews? A. They are quicker to complete. B. They provide subjective information. C. They are less reactive. D. They provide objective information about the behavior and its environment. Answer: D. They provide objective information about the behavior and its environment. This question asks about the benefits of direct observation in FBA. Direct observation involves watching the behavior happen in real time and recording the antecedents, behaviors, and consequences. ABC dite. This provides objective, factual information about what actually happened, rather than relying on someone's memory or interpretation, which can be subjective. Indirect methods are quicker but less reliable, while reactivity, behavior changing because it's observity, can be an issue with direct observation. The objectivity of the data collected is a major advantage over subjective reports. Getting objective data is key to accurate analysis. Question 24. When teaching a new behavior using discrete trial training, DTT, the therapist presents a stimulus, waits for the learner's response, and then provides a consequence. This sequence, stimulus greater than response greater than consequence, is also known as the A. Behavior chain, B. Task analysis, C. Three-term contingency, D. Reinforcement schedule. Answer: C. Three-term contingency. This question ties the discrete trial teaching format back to the fundamental principle of behavior analysis. The sequence used in DTT, presenting a stimulus, like an instruction or object, the learner doing the behavior, making a response, and then the therapist providing something that happens immediately after, a consequence, often reinforcement, is a clear application of the three-term contingency. Antecedent behavior consequence. A behavior chain is a sequence of responses. A task analysis breaks down the skill, and a reinforcement schedule determines when reinforcement is delivered. The SRC pattern of DTT is a direct example of the ABC contingency in action. Question 25. If a child's hitting behavior occurs primarily when another child takes their toy, and the hitting results in the other child giving the toy back, the function of the hitting behavior is most likely: A. Attention, B. Escape, C. Tangible, D. Automatic. Answer: C. Tangible. This scenario describes a behavior maintained by access to a tangible item. The antecedent is having a toy taken, the behavior is hitting, and the consequence is getting the toy back, a tangible item, since getting the toy back makes the hitting behavior more likely in the future when a toy is taken. The behavior is being reinforced by access to that specific item. This is different from getting social attention, escaping a task, or sensory input. The key is that the consequence of hitting is getting or regaining a physical item.